Thank you, everybody. Thank you, Reinhard, and thank you to Chris. As ever, it's humbling and not a little difficult to follow someone like Chris on a platform like this, because Chris and Jane and the other people with dementia whose voices are now being heard so eloquently and so loudly really do embody what we're trying to do around dementia. But here, as a humble civil servant today, I'm just going to talk you through quite quickly the policy framework that we're working within, the Prime Minister's Challenge to 2020, which is the document which Reinhard referred to, really the document that is driving the work forward, but hopefully I can take you perhaps a little beyond the words to sort of tell you what the programme entails and what we're hoping to achieve. I'm just going to struggle to work the IT now, but I hope just a press of the button will get us to my slides. Let's see if I can just move that forward. Here we go. That's good. So the first slide, which may be a little difficult to read, but hopefully these will all be available to you afterwards, just sets out for us, in case we needed reminding, really the scale of the challenge that dementia presents to us in the UK, but also worldwide. I'm sure many of you, as a very well-informed audience here in Manchester today, are very well aware of this. But dementia is a priority for this government, for this Prime Minister, and for all of us, I'm sure, in the room, because of the tremendous scale of the challenge it presents, not only to our health and care system, to our society, and to many of us as individuals. On current estimates, around 600 to 700,000 people in England have dementia, getting on for 1 million across the UK. And of course that impact is hugely magnified by the families and carers and people affected by dementia, as well as those who actually have the condition. We know that there are variations in services across the country, the postcode lottery that Chris referred to just now, and that's something which we are trying to address. We estimate that in hospitals alone, around a quarter of all beds, and that's all beds, not just in older people's wards, are occupied at any time with people with dementia, and that's possibly an underestimate because we know that dementia isn't always diagnosed. Dementia's costs to society are huge in financial terms, more than the costs of other diseases such as cancer, heart disease or stroke. And these costs are predicted to grow, and to grow dramatically over the next few years. And if we think more widely in our economy, dementia will affect the numbers of people who are able to continue working, and so we mustn't forget the wider impact of dementia on our society, and that people of working age with caring responsibilities, and also, as in Chris's case, their own ability to continue working, must be something which means that society must address this challenge. We cannot just sleepwalk into this. We have to be aware and we have to take action. And so I'm just going to talk about some of the action we're doing. I'm sure there's an easy way to do this. Here we go. Apologies everyone for this. So the programme of work on dementia for the Department of Health hasn't just started with the 2020 challenge, as I'm sure you're aware. Really it started back in 2008 when the country developed one of the first national dementia strategies in the world, in fact. And many people in this room probably took part in developing that national dementia strategy and in delivering the aims of it. So that strategy was called Living Well with Dementia, something, as Chris says, that is a great aim, but difficult to do. But that strategy set us down a path which we're still on, a journey which we're still taking, which is about improvement, trying to raise awareness, which I think we're making some inroads into in our country, trying to turn that awareness into understanding, trying to inspire professionals to take up this area as something to work on in research and in the clinical and non-clinical professions, trying to ensure that the society as a whole embraces dementia, brings it out of the shadows and galvanises society around it, and trying to ensure that we take steps to protect our future by looking for drug therapies or indeed cures, which might mean that dementia is perhaps not the threat and the difficulty to our society we think it might be at the moment. Building on the National Dementia Strategy of 2009, David Cameron, the Prime Minister, took up the challenge personally with dementia in 2012, and we published as a department the first Prime Minister's Challenge on dementia. And that took us, that set out a 3-year programme of work, which looked at raising awareness of dementia, investment in research, increasing that, and looking at the health and care sector in particular. And one of the things that we really focused on in that first Prime Minister's Challenge was diagnosing dementia in a more timely way and in a better way, and for more people. And I'll come on to tell you how we did on that in a moment. Bringing us slightly more up to date, we published a new Prime Minister's Challenge just before the election in 2015, which set out how we were going to take the next step change to the end of this Parliament, which is 2020. And just most recently, in March 2016, my team and I published the implementation plan, which really sets out the actual steps we're going to take to make this challenge a reality. So how are we doing? There is some cause for optimism, I think. We're making some progress. So more people than ever are receiving a diagnosis of dementia. When the 2009-2010 time span and the strategy then, we estimated around 42% of people who we estimated to have dementia were receiving a diagnosis, and that was too low. Diagnosis in itself can be a difficult and painful process sometimes, but there is an understanding among the clinical profession and among people receiving that diagnosis that it is worthwhile. In most cases, it really is worthwhile because it opens up the route to services, or at least it should. So it's important that that diagnosis is made. And so now we're diagnosing around 2/3 of people, which we think is up there with about the best in the world for diagnosis rates. And that's testament to some tremendous effort that's been placed by the National Health Service, by NHS England, and by people like Professor Alistair Burns from our own Manchester, who has been leading the strive to diagnose better, but also to transform health and care for people with dementia. We're working towards creating a much more dementia-friendly society, and with our partners in the Alzheimer's Society and with a number of other charities and organisations up and down the country, dementia-friendly communities are breaking out, and this is a delight. This is just a delight. This is ordinary people in their ordinary jobs really recognising that dementia is not something that should stop people living well or enjoying their local community services or taking part in their society. And this is about areas thinking really carefully about how they can improve things for people with dementia and finding that they can improve things for everyone in many cases. And this is really inspirational. We have over 1.5 million dementia friends. And again, our partners, the Alzheimer's Society, have been really instrumental in driving this forward. A really simple programme, but something which has raised awareness of dementia hugely in our country, around people knowing simple things they can do to make life a little bit better for people with dementia in their everyday lives. We're really focused on professionals in the health and care system, and everyone indeed working in the health and care system. So to date, around 600,000 staff in the NHS and in social care, and we think that's a low estimate actually. We think actually the numbers are much better than this, have received training on dementia. We want to make sure that everyone working in the NHS and social care has a level of training and understanding of dementia appropriate to the job they're doing, and we're striving for that in the latest challenge. We have started to try to catch up in terms of investment in research for dementia as opposed to those other conditions. So funding for dementia research from government has doubled under the last government, and we are projecting that to continue to 2020. And indeed, funding from the charities as well is actually coming in to increase along the same pace, and that's really pleasing to see and absolutely necessary. And I'm just going to give a plug for Join Dementia Research, who are here, I think, as a stall today. Join Dementia Research is a fantastic programme where people can sign up to take part in research studies. That's people with dementia or people without. And it's going to be absolutely necessary that we have more people taking part in research studies if we're going to get closer to drug therapies or a cure. So having said we've made some progress, there is no stepping off the gas on this at all. We recognise that there are some significant areas that we need to tackle in order to really transform our country and make it the best place to live with dementia. So that's why we need another challenge, and I'm really pleased, although it's hard work, to see that we have another Prime Minister's Challenge to 2020. It's an enormous programme of work, of which I'll talk you through in a moment. But it builds really on the achievements and where we started with the National Dementia Strategy in the previous challenge. We really set out in detail what needs to be done by 2020 in order to make that next step change. And we focus on risk reduction, on health and care, and that's all aspects of health and care beyond diagnosis and through to all parts of the system, including end of life. We really want to make sure that dementia-friendly communities take off all over this country, and we want to really make sure we keep up the pressure in the research environment. This is a really difficult slide to read, so I recommend you have a look at it afterwards, but I'll talk you through it really, really quickly. This is just setting out, as Reinhard said, some of the real priority areas around the challenge. I've got 5 minutes, so I'll be quick. So in risk reduction, some of the areas we really want to focus on are ensuring that people know what they can do to manage the risk of developing some dementias in their own lives, through action they can take, for example, in midlife. So one of the things I'll pick out here is Public Health England, alongside Alzheimer's Research UK and the Alzheimer's Society, is working at the moment to develop a way of talking about dementia and brain health risks for people at 40 plus. People around their 40s are not necessarily thinking about dementia as a risk. They may be thinking about heart disease or other risks. And so they're working out a way that brain health can be brought into that conversation so that more people can realise that there may be things they can do to help minimise their chances of getting dementia. In health and care, as I said, diagnosis can be the gateway, we hope, to receiving or opening up the door to services. We know that that's not the case everywhere. We know that it's patchy in some areas. And so we really want to ensure we keep up the pressure to make sure that diagnosis still happens and that it happens well. But importantly, we're shifting the focus, as well as maintaining that diagnosis rate, to look at post-diagnosis support, to look at the services that are available to people once that diagnosis is made. We really don't want Chris's story and Jane's story to be the story faced by people going forward. We don't want people to feel alone or abandoned. We want people to feel supported. And the GP is often the place where that can happen, and sometimes happens well, and sometimes doesn't. And we need to make sure that we even up that playing field so it happens well more often than not. So we're really working on that. And we're working on a concept of meaningful care, which is talking about that diagnosis. It's talking about access to relevant advice. It's talking about support for carers, because we know that carers are absolutely instrumental here, and that sometimes they're frozen out of the conversation. We can't have that be the case. So we're working closely with NHS England and other partners to make sure we have a comprehensive programme of work over the next 4 years to transform that experience post-diagnosis. We're working on making sure that hospitals and care homes and every environment really around health and care become more dementia friendly. We want to keep up our momentum on training staff in health and care to make sure everyone's appropriately trained. On dementia friendly communities, we want to add another 3 million dementia friends, so we want to really make sure that social movement becomes commonplace in our country. We want to make sure that dementia friendly communities are the norm, if we can make it so that everyone has the ability to continue life as near as possible to what it was before dementia was part of their lives. And we want to make sure that businesses and the whole environment ensures that people can continue working if they're caring with someone with dementia, or indeed they're aware that their staff might be showing the signs and symptoms of dementia, and that the workplace can be an important part of support, as well as big businesses recognising that dementia is something that means they should adapt their products and services to be fit for the future in our country. And finally, on research, this is a huge challenge. Research is necessarily on a long track. It's a very long-term investment that we need here, and we're keeping up with this. But we are pleased to announce that we have a National Dementia Institute is going to be established in the UK, and that we hope is going to really boost the basic science and also care research to ensure that we get nearer to that cure and better treatments and therapies for dementia. I'm just going to quickly give a plug for something here, because I recognise that we may have, thank you Reinhard, we may have some commissioners of dementia services in our audience today. So when we published our implementation plan in March, we also published a quite important document, which I don't think has had quite as much airtime as it should have done, so I'm plugging it today. We published a joint declaration on post-diagnosis dementia care and support, and that was a whole range of national organisations from the Department of Health, National Health Service England, and all kinds of other bodies, including local government, signing up to make sure that good post-diagnosis support is something we should have everywhere. We want to make sure that that national declaration of support for this filters into local services. So I would just remind any commissioners in the audience, and indeed anyone working in organisations where they come into contact with commissioners, that this document exists. And if you get a copy of the slides afterwards, there is a link to the document that you can get to quite easily. I'm just going to flip past this. How will we know we've made a difference? So 2020 is when we are working on seeing a difference. But in the meantime, we're going to have a couple of staging posts to that. Having just launched our implementation plan, which is, as I said, an enormous programme of work across those areas, we're establishing a new programme of engagement so that ordinary people and citizens all across England can tell us how we're doing. Importantly, we need to know by 2018 that we're on track. And we want to publish a revision to the Prime Minister's Challenge in 2018 and an update to that implementation plan, which reflects the progress we're actually making rather than what we think we're doing. So Chris, I think, will mention this a little later, and I'm hoping other speakers do too. But later in this year, we hope to launch a new programme of engagement which will involve citizens from across the country who can tell us how their real experience of dementia is working out for them and whether our challenge is making any difference. We would like everyone to start to engage in this. My team and I work hard, but we cannot deliver this alone. We need everyone in their local areas and in their local services really pushing in the same direction on this. So there are resources available, a load of them on the web, that have been developed by a number of bodies to help people, including things like the Dementia Roadmap, which helps GPs, after diagnosis, signpost people in their local area to services that can help them, and the declaration I've already mentioned. We importantly want to learn from examples of good practice. We want to know where things are working, because then we can use our voice in national government to make sure more people hear about this. They go and see, that they contact each other and have a huge conversation about how to get better at this. So you can really help me in this. So, if you have thoughts, questions, things to tell me that are going well, things that aren't going so well, please contact me and my team on this email address, 2020dementia at the Department of Health. And please do continue to do all the great work you're doing, which is going to help us make Dementia 2020 a reality. Thank you so much for listening.